It was again a very positive and very constructive meeting dealing with the challenges of COVID-19, working together to deal with those challenges, to deliver solutions and responses in a collaborative and cooperative way. Today, the Premier of Victoria and I concluded a memorandum of understanding to develop a new quarantine facility in Melbourne. That facility will both assist the Victorian Government, who will run the operations of that facility. We will develop the facility together with the Victorian Government, but the Commonwealth Government will meet the capital costs of that. The Victorian Government will meet the operational costs and will run the facility. This will both assist them in the risk management of the various groups that they're providing for in their quarantine system, as well as delivering additional capacity for the quarantine system in Victoria. And that is a very welcome process that we've been through with the Victorian Government, a very, very good proposal, one that I was very pleased with when I first saw it, and I want to thank our officials and the Victorian officials for working so quickly through to the agreement we've reached today. Today we also noted the temporary COVID disaster recovery payment that I announced yesterday. We discussed the cost-sharing arrangements and have agreed nationally across the country that the cost-sharing will work on the basis that the Commonwealth will provide the direct personal income support, that is through the temporary disaster recovery payment for COVID, and that state and territory governments will meet the costs of business support that are as a result of lockdowns that may be put in place by state and territory governments. So it's a very clear allocation of responsibilities. We will do the individual support after 7 days, consistent with a hotspot, as I announced yesterday, and for business support, that will be the responsibility of state and territory governments. To ensure that there is as much uniformity and consistency in those business support arrangements, that has been referred to the meeting of treasurers, who will seek to get some consistency in the business supports provided in those circumstances. But we're all agreed that the best thing we can do is ensure that we open up states, territories, cities as quickly as we possibly and safely can, and I know that is the objective of the Victorian Government and all other state and territory governments, to ensure that such payments are not necessary, because we're keeping Australia open and keeping our economy moving ahead, as the national accounts had demonstrated, as we found out over the course of this week. We also referred to the medical expert panel, the AHPPC, the post-quarantine testing arrangements. That is a matter that the AHPPC has considered on many occasions, and in review of events over the last few weeks, it was considered appropriate the AHPPC consider some uniformity in how those arrangements are dealt with between states and territories, and I'll ask the Chief Medical Officer to speak more on that when he makes his remarks in a few moments' time. We discussed the vaccine rollout. I'd say it was a very positive discussion about the vaccine rollout amongst Premiers and Chief Ministers in the Commonwealth today. It has been another record day. I can say 143,659 doses delivered in the previous 24 hours. We are now over 1 million doses in 10 days. We are now over 750,000 doses in the space of a week, and that is a significant improvement from when I first brought National Cabinet together back in April, and we put in place those new arrangements, which has seen us grow from around 320,000 a week now to 750,000 a week. So that has been a significant improvement, and I thank the states and territories and the Commonwealth agencies that have been involved in ensuring that we can move to that level of dosing, and both the Health Minister and the Secretary of Health will make further comments on those matters. In particular, it was agreed today there'd be further simplification of the arrangements on the vaccination program, and that will include bringing forward access to 40 to 49-year-olds for their doses by June 8, and I'll ask the Secretary to speak more to that. On aged care, a very clear message from all states and territories, together with the Commonwealth. It is very important. It is a high priority for those who are working in residential aged care facilities to be vaccinated. That is why, both through the Commonwealth and the states and territory governments, priority is being afforded to those workers to get vaccinated at the many points of presence that are available to them. and that includes fast lanes, green lanes, priority lanes that are put in place by states and territories, as well as through the GP program for them to have priority on appointments. In addition to that, though, we agreed to an in-principle disposition. Now, what does that mean? We're leaning heavily into this. Make no mistake, we are leaning heavily into this as leaders of governments and myself as Prime Minister to see us move towards a mandatory vaccination for aged care workers. We had further advice from the AHPPC, which means that we have tasked the AHPPC to advise us how this can safely be done, including a suitable time frame by which that could be achieved. And so we will be expecting prompt advice back from the AHPPC about how we can introduce such an arrangement. Now, for vaccinations to be made mandatory for aged care workers, that has to be done by public health orders at a state level, as it is done for flu vaccinations, and that is followed in many states and territories around the country. Ultimately, that is finally a determination of the states and territories. But there was an agreement, and I can assure you I was very firmly of this view and supported strongly by states and territories that we need to look at how we can do this safely. But the first point is, if you're working in aged care, indeed working in disability care, I should have noted that both of those have been referred to the AHPPC, we encourage you to go and get that vaccination. There are numerous points of presence, numerous places where you can go to receive your vaccination. But the first priority, of course, was to ensure that residential aged care facility residents themselves were vaccinated, because they were the ones most at risk